Okay, thank you very much for inviting me here today, and thank you very much to the audience. Uh, I must say, when I got this invitation, the first thing I did, not being a native English speaker, was before accepting it, was to look up in the dictionary the meaning of the word experience, because I wasn't sure whether I'm experienced enough to talk about this. So gladly I did look and I realized experience means having a practical involvement, observation of facts. And I said, okay, bingo, then I can do that. Why do I think so? I think so because even when I didn't know about open access, dating back 2000, the year 2000, as a young graduate in Ghana, when I had my first experience, I had then just been employed as a broker journalist. I remember the enthusiasm that anytime I had a chance to go on radio, I wanted to talk about my research. The little research I did as part of my first degree dissertation, but I didn't know about open access, but I was just passionate about that. And that followed me straight to when I started my PhD here at Brunel, when one of the first questions I asked my supervisor then was, is there a radio station around? And I was told there is a Hayes radio station. And I gave the programs manager a ring. And my question was, I've got this pilot study that I've done on demand for physical activity. Is it possible that I could come on radio and talk about that? He said, yes, you can. So that's where my passion is. I'm really passionate about this. I can't imagine the over 20 years experience the previous speakers have, but what I probably got is the passion to make sure that I learn about this, and I'm able to use it. The experiences I'm coming to talk about are a function of excellent groups that I've been privileged to be part of. Some of them were in the audience, so they're from the psychology department here, Brunel, sports sciences, and also the support, the wonderful support that I've gotten from the team here, the organizers. I remember sometimes late in the night, I have to send my data management plans to Catherine to look at them for me and to revise appropriately. Okay, so I'm going to start with my lessons. What are the lessons I've learned? What have I learned from the experiences I've had so far? The first lesson is start early. Whether you want to stay ahead of the game or you want to stay last, start early. The other lesson that I've learned is open access is not just about making your work available to end users, but also involving them and allowing and giving them the opportunity to influence your work right from the outset, and also letting them know as and when your output is coming. Because there is no point making it available if the end users don't get access to them or don't use them. So these are my experiences. And these experiences have reflected in the sort of activities that I've been engaged in so far. And these activities, I like to cover them from the conception, data collection, analysis stage, and the dissemination stages. What do I mean by conception stage? It relates to the starting early. So many a time, at least to mine, initially when I thought it was not being naive, I only thought it's about disseminating. So you only start thinking about it when the work is ready and you're going to give it out. But in fact, that's not the case. Right at the point that you write in your research proposal, straight to the point that you've been given the grant and you're setting out to do the work, I think you need to start planning and the work starts. So what have we done? I would like to give an example of emphasis, which is a project currently ongoing, a Department of Health project. And what we did in this particular project was to set up an advisory committee which was made up of all the stakeholders. And the stakeholders here included policymakers, practitioners, academics, and public and patient representatives. Now, what we did was, the work was about assessing the cost effectiveness of physical activity interventions. So for the public and patient representatives, we did not select people who are inactive, but also people who are active as well. Because their understanding of the work might be entirely different from how we see it as researchers. And I must say, it's been very good working with them. They've challenged some of the ideas, and they've ensured that the messages that we're trying to get across are crafted in a way that will be received well. And how their involvement has been is they've been attending all the meetings, not just to ask questions, but also to help us write the lay summaries. Now, how, I know you might be thinking, you're talking about economic evaluation, you brought in public and patient representatives, people probably with no expertise in economic evaluation. How can they constructively contribute? We went about this by enrolling them in a 3-day introductory course in economic evaluation right before they started the project. So they had an understanding of the main concept, and they could critically review the sort of things that we're working on. Another aspect of conception with my experience has been the range of data management. I think it's currently becoming a bit more popular, but previously, with my limited experience, data management sections of research proposals tended to be quite a small part of the entire proposal. But over time, this is changing. So recently, we put in an MRC fellowship, MRC grant. And I was amazed to realize that now you're supposed to do a 3-page. 3 pages on your data management plan. Now, my lesson here is that many a time we tend to focus so much on getting the rationale bits of the proposal, the case study bit. Now, your proposal could fail or not depending on your data management plan. So you need to start early and have working teams working on that data management plan. In terms of getting inputs, for those who might not be aware, there are issues around security, there are issues around preservation of data, and how you make data available to the end users. And here you can get inputs from the governance team at Brunel and the research data management team as well. Another bit which Steve has covered greatly in his presentation is research impact experts. I would advise that you involve them as early as possible, even at the proposal writing stage, and also immediately you've won the grants. Why do I say so? The operationalization of your ideas, of the way you intend going about ensuring the impact of your work, actually kicks in when you start the work. And although you may have all these ideas which you put in your proposal, you receive the money, sometimes you get the money and realize, oh, did I really say that? To ensure that, what we've done is, gladly, we have the opportunity of working with Steve and colleagues. So with emphasis, we developed a project startup document, which was to set out how we're going to operationalize and ensure impact of the work. And that document is developed even before we start the work. Enough of conception. Let's move on to data collection. For data collection, to me, it's not just about making your data available. It's also about making the instruments or the tools you've used in collecting that data available. Because it's about transparency. So what we've done is, the nature of our work, we normally have questionnaires that we go out and conduct surveys. So one way you can do that is making other academics right aware of this. As you finish, even throughout the process of doing the research, or afterwards, supplying these as online supplements to your published articles. Or you can even publish them as protocols, which some people tend to do. So take home message, not just the data, but how you got the data. There is a DIRIUM database which is relevant to the health researchers, where I think it's been in operation for the past, if my memory serves me right, the past 3 years. And what that database is dedicated for is they've got instruments that people have developed, and that's a database for that. So if, for example, you want to collect data about health service use, you just go there, search, and then you will get samples that you can use. Another key thing for me is data entry. Making your work available and accessible to people, I think, requires that you do good quality work so that that can be replicated. And what we've done to ensure that our data entry, so that the data coming out is of good quality, at least to the best of our abilities, is that we've included non-subject matter experts in imputing the data. The reason we've done that is, many a time when you look at a questionnaire, let's say you're asking somebody about how many days in a week have you been exercising. If you are an expert in physical activity, you are likely to know that on the average, just about a few, probably the upper end is maximum 6 days. You hardly get people exercising 7 days. And with this knowledge, it's likely to influence when you see the information on the questionnaire. But with non-subject matter experts, what they do is they tend to just input the data as they see them without any interpretation, because that's what you want to ensure, particularly if it's a self-report data. So that's what we've done. And to ensure this, we've also been conducting trainings with them. So we just don't leave the people who have been inputting the data. We organize training sessions for them before and even during the course of the data entry. And this is also supplemented by checks that we do. Sometimes these are random checks. We take a portion or a random selection of the data selected at various points to ensure that they match in with the information on the questionnaire or the survey instrument. Moving on to data analysis. This may not be relevant to some people, but normally when you are involved in clinical trials, the data collection is done by the clinical trial team, and then the data is then sent to the economists who work on them. These clinical trial units have got fantastic and big teams behind them who look at the data, they clean the data and send them to you. So one could argue it's perfectly fine to start using the data when you get them. But we haven't done that. What we've done is, as part of the team that we've worked, we've all agreed on a dual integrity checks. And these dual integrity checks are to set up theoretical frameworks that will check that given that a person or a patient gives this answer in the main question, then the expectation is that a reasonable answer or the right or potentially right answer to a follow-on question should be this. And these checks we've been doing together with the clinical trial team. So when we get the data, we also run these checks, and these checks are set in advance to avoid manipulation or data or manipulation of answers. Another thing I'd like to talk about is the transfer of data to an analytical formats. And this is particularly relevant in cases where you collect your data. So you use a survey instrument to collect your data. Recently, we've been involved in a community intervention for physical activity in Hayes and enhanced learning environments. And we've been collecting data at 6 different stages. So 3 stages before the intervention and 3 stages after. Huge, messy data. The data is then imputed into Excel. If you're going to do your analysis in Excel, it's fine, you just do that. But many a time, the softwares that we tend to use, these statistical softwares, for example, Stata or SPSS, requires that you have to transfer your data to these softwares. Errors could happen during the transfer. And also, have you ever considered to ask yourself whether, if you give your data out in Stata and the person who is going to use the data uses SPSS or even uses Excel, you need to allow them that flexibility. So what we've done is that we've hired programmers who have used program language so that once you get the data in Excel, here is to ensure and promote transparency. Once you get the data in Excel, the raw data as we collected it, you can then run that program and you see the movement of the data from Excel to whichever statistical software that you are interested in. And this is to ensure that the readers or the end users are fully aware of what's going on. In terms of analysis plan, we've been using, what we've tried is to make sure that before we conduct the analysis, our analysis plan are published as part of protocols. And obviously there could be changes in our analysis as we go on, depending on the nature of the data. But then anytime there is a change, then we could go back and then identify and indicate why there was a change or why we're deviating from our protocol. To the last stage, which is dissemination. I don't think I'm going to say anything new here. These things may be obvious to you already. The very first bit is user-friendly interface. With the models that we work with, simulation models, Markov models, they are usually quite complicated. And to allow these models to be used by local commissioners or national commissioners, we've tried and developed an interface so that the actual modeling is in the background and there's a simple interface where the user could just input data, very simple data, and still get the answers. And the reason we've done this is to ensure that there is an increase in the number of people who use our models. We've also, thanks to Brunel Open Access Fund, we've been trying to publish our data, whether being articles in open access journals as much as possible. And also, most importantly, we haven't left our presentations at the end of the work. We've been having frequent and regular interactions with policymakers or end users throughout the project. And the reason we've done this is to make sure that the answers or the questions we're trying to answer are crafted in the language of these end users, and that they know that these outputs are coming at some point. We've also been using social media and then press releases. This might be obvious, but probably not to some. Normally, with projects, we tend to announce when the projects are finished. So we tend to develop press releases when our articles are done, but I think we can do more than that. When you get a funding, you can then have a press release to announce, to let people know that this work has been funded, is going to come out in 2.5 years' time, so that they could be looking out for that. And I must say, anytime we've done that, we've then had requests or follow-on emails from sometimes editors of journals contacting us to say, okay, so when actually is this output going to come? So right at the initial stage, you are aware of where you intend to publish and that people are waiting for your results. So that's one effective way that we've used in promoting our work. Now, then so what? I know you might be thinking, so you've been talking about all this, and so what? What have you found? In my estimation, I think this has given us higher impact in a small way, I should say, being modest here. Our economic models, as the introduction said, has been used frequently by NICE in developing public health guidelines. And we couldn't have achieved this without making our work available, without using open access. It's also helped, or it's also led to future collaborations. Because sometimes through the press releases, through presentations, through interacting with stakeholders, you get to meet a few people with similar objectives or with similar research interests, and that triggers off future work. Then the usual benefits of increased citations have also been found as a result of the approaches we've used. And increased interaction. I find this quite interesting, the last point. The reason is with researchers, we might have been doing our research for, let's say, years. Sometimes to come out with policy relevant questions requires discussions with the policymakers. Because there are gaps in the literature we want to fill, but as to whether these gaps are the sort of gaps that policymakers want filled, it's another thing altogether. And what I found very interesting, is that through interaction with policymakers, they are able to let you prioritize the sort of research agendas you want to pursue. And I found that very interesting and helpful. Now the challenges. For me, the challenges in ensuring open access or making it possible is the resource. And being an economist, I'll talk about time and money here. I think the time and the money involved, particularly when you haven't costed this in your research proposals, could be quite tricky. Because you need time to develop your metadata. You need time to make sure that your questionnaire is in an accessible format. You need time to go out and make presentations to interactive stakeholders. So one take-home message could be, make sure that when you're putting in your research proposals, you cost the time you're going to spend and the money you're going to spend in ensuring open access. And also the creation of user-friendly interface. I think being scientists is sometimes a bit difficult to understand the language that the end users will want things to be put in. So that has been quite challenging as well. But in all this, I would like to end with, I think there are different ways of achieving this. What we've been doing, it's a way, it might even be the incorrect way, and other people have different ways of doing that. But the good news is that we are all in agreement that open access is a good thing, and we want to make maximum use of that. Thank you.